Hi, my name is Jean Digitale. I'm a fourth-year epidemiology PhD candidate and former PICU nurse, and I'd like to tell you about my project, predicting earliest safe extubation time for pediatric intensive care unit patients. In the pediatric intensive care unit, about 30% of patients require mechanical ventilation. It can be challenging to decide the earliest safe time to take them off the ventilator or extubate them because consensus guidelines are lacking. On one hand, if patients are not extubated soon enough, excess ventilator days lead to higher risk of ventilator-associated adverse events and increased costs. On the other hand, if extubated too soon, extubation failure is associated with longer PICU length of stay and higher mortality. The objectives of my project are to enhance identification of the earliest safe extubation time in the PICU by harnessing the power of artificial intelligence. We aim to predict when to extubate patients and then safely shorten extubation times by identifying subsets of patients for earlier extubation. The study population consists of PICU patients from 1 month to 18 years old at UCSF Children's Hospitals, where the 24-hour extubation rate is about 3%, compared with the national benchmark of 6%. To be included, patients have to be intubated for at least 24 hours. The data from this project come from the UCSF Electronic Health Record, or EHR. It includes patient characteristics, diagnoses, medications, ventilator settings, vital signs, labs, and more. We then use these data to train predictive models using multiple machine learning algorithms. In particular, we're planning to use a novel method called expert augmented machine learning. This aims to increase generalizability by incorporating expert judgment directly into a machine learned model. We'll then evaluate model performance with both standard and clinically meaningful metrics. The ultimate goal of this work is to improve care for patients in the PICU. And with that aim in mind, we're working with a team to implement the model into the real-time EHR at UCSF. As a first step, the model would be run in the background to see how it performs on current patients. And we have an ultimate goal of doing a randomized intervention. I'd like to thank the ARCS Foundation, patients and clinicians in the UCSF PICUs, and all of my mentors. Thank you.